So one of the most common questions I get right in the beginning when a patient's going through their evaluation in my office is, how do you measure progress? How do you know if you're making progress? And the answer lies within the process that we refer to as the common way cancer cells cloak themselves or hide themselves from the immune system. And what I'm referring to is some research done by a Dr. Yamamoto in Philadelphia, Pennsylvania, back in the late 90s, where he discovered an enzyme that all cancer cells secrete. When a normal cell switches into this abnormal metabolism we've talked about, they all simultaneously start secreting an enzyme called Nagalase. And Nagalase is this enzyme that goes in the body and turns off the macrophage cells. Now, what are the macrophage cells? The macrophage cells are a very specific kind of white blood cell whose normal job is to find and kill abnormal cells, which are the cancer cells. And this Nagalase enzyme binds to vitamin D receptor sites on the cell membrane and makes it impossible for these cells to detect the tumor. So I call it cloaking. It allows the tumor to cloak itself in such a way that the immune system cannot detect its presence. Now, the good thing, the positive thing about this Nagalase enzyme is we can do a simple blood test that can detect the level of this Nagalase enzyme. And the way we utilize it is we draw this Nagalase blood test at the beginning of treatment and then do what's called sequential or serial testing, where every roughly month to 6 weeks, we repeat this Nagalase blood test. And by the level of the Nagalase that returns from the lab, we can tell if we're making progress, because universally these Nagalase enzyme levels are elevated in cancer patients. And as we proceed with treatment, either we see the Nagalase progressively going downwards, or if we don't, we change the protocol until we start seeing these downward trends, because that is what tells us if we're making progress. Now, of course, we utilize all the standard testing. There are certain what are called cancer markers in blood tests for certain kinds of cancer, not all, and we utilize those as well. And we also use all the standard scans, CAT scans, PET scans, and MRIs. But of course, there are limitations with standard testing, such as the CAT scans and PET scans, because of the radiation exposure. And so you're not going to repeat those kinds of scans once a month, but a simple blood draw, blood test that a tube is sent to the lab, there's zero toxicity. And to be sure, there is no test on the market that's perfect, but the best way to get the best information is to do as many different tests as you can, and then on the ones that are safe, you can do serial testing to measure progress. So that's how we measure progress.